back to St. Francis during the daytime, you can actually use this entrance right here in front of us that says Radiation Oncology South Entrance. That's open from about 8 a.m. to 5 p.m. Monday through Friday. If you're coming in at a time after those hours or over the weekend, you'll want to go around the back to the emergency room entrance. At both entrances, you'll have to get screened. They'll do a series of coronavirus screening. You'll notice here on your left, the main entrance to the hospital is closed. So the only other option is to go here around the back to the emergency room. Again, that coronavirus screening initially will just be some questions to evaluate your risk if you're having any symptoms, if you've been in contact with anybody that has known coronavirus, or if you've been tested recently. So here around the back side is the emergency entrance, and you'll notice the big emergency sign in red. So just head on in there, let them know that you're checking in, that you're pregnant, and then they'll call someone down from the labor and delivery department to come get you.
This is the second floor of St. Francis Hospital. So you can see the sign here straight ahead is the labor and delivery ward. And then on this side is the postpartum unit where you'll go after you have your baby. This is the entrance to the St. Francis labor and delivery floor. And when you get here or a visitor gets here, you'll push this button in order to be let in. And as you can see right now, there's a policy of a maximum of 1 visitor due to coronavirus. This is a labor and delivery room. So here's the bed that you'll get to labor in. And as you can see here, you'll have a monitor that's monitoring you and your baby at all times. Lots of different things you can do while you're in labor. If you like, you can get up and walk around. In fact, you can even get up and you have a private bathroom with your own jacuzzi tub that you could use if that's helpful for you during labor. During labor, people like to use lots of different techniques to help. Some people like to use a birthing ball that they can bounce on. Some people like to lay in bed with a little peanut between their legs. Even something called a birthing bar, which we can attach to the bed and allow you to be in different positions when you're pushing or when you're in labor. So when you first come into the room, you'll get a gown to change into, and then you'll get to lay down in this bed, and all of our pregnant mamas will get monitored. So these are monitors that will go on your stomach that will monitor the contractions that you're having and also monitor baby's heart rate. And the provider and the nurse will get to see the results here. You want to have a partner here to support you. This is an area that they can use to rest. You can have pillows and blankets here, or it's an area that they can use just to sit and support you. After you deliver your baby, we like to get the baby skin to skin right on mama, but sometimes the baby needs a little bit of extra support, in which case the baby will be brought over to this warmer, and that's where the doctors and the nurses will help support the baby in any way they need. And as soon as possible, baby will come back over to you. Your doctor works with a team of doctors, all of whom are pictured here, and one or more of us will help take care of you in the hospital and deliver your baby, along with the amazing nursing staff at St. Francis Hospital. We look forward to seeing you when you're in labor.